Phil Robertson with us now, Deputy Director of Human Rights Watch Asia Division. He's on Skype from Bangkok. Phil, we focus so much on social distancing. And when I looked at those pictures there, it's impossible. It is absolutely impossible to think about that. Have you got any thoughts on what can be done?
Well, the most important thing for the Bangladesh government to do now is turn on the internet for the Rohingya refugees in those refugee camps so that they're able to communicate with humanitarians and with other persons about what is happening and get accurate information. I mean, it's astonishing the kind of restrictions we're seeing on those camps, especially in this time of a pandemic that's going to threaten the health of so many. You know, when you look at those camps, as you said, there's no social distancing. You talk about washing your hands, but, you know, often access to water is limited. You know, it's a disaster waiting to happen. It's an absolute tinderbox for COVID-19.
So again, I take your point about what the Bangladesh government could do, and the internet is very important for information and communication, but I'm just thinking about sort of practical things which could happen now. I know there's people trying to supply aid and sanitation services. Is there anything more which can be done on that level?
Well, I mean, the government of Bangladesh should allow for the Rohingya groups to do information campaigns about how to prevent transmission of COVID-19. What has been happening is that the Bangladesh officials have been saying no to those kind of campaigns unless they're running them themselves. And people need to be able to get the information. But the government claims that such campaigns would prompt panic. The real panic is going to come from people who don't know what the situation is, and they have no information about what COVID-19 is or how to stop it. You know, the government is not allowing people to use the internet so that coordinated efforts could be taken by humanitarians on public health issues. You can't even call the government hotline from the camps if you want to be referred to a government hospital. You know, they're trying to do things in the camps with both hands tied behind their back.
Are you and other groups in direct contact with the Bangladesh government over this?
The Bangladesh government, unfortunately, has not been listening to NGOs and to other governments about this issue of the internet access and the health crisis in the camps. You know, I think that there has to be greater pressure put on the Bangladesh government to realize that this is a wrong-headed policy that has to stop. Otherwise, there may be a very grave tragedy that occurs in the camps of the Rohingya.
Phil Robertson from Human Rights Watch, I'm glad we could talk to you about this. It is very important, of course, to keep these issues in the spotlight in these times. Thank you.
Thank you very much.